Menopause supplements. What works, what doesn't, and what you should know. Opening music fades in. Narrator. Menopause is a natural life stage that every woman reaches, but the symptoms, like hot flashes, night sweats, mood swings, and sleep disturbances, can be anything but easy. It's no surprise that many women look for natural solutions. Walk down any pharmacy aisle or scroll through Amazon, and you'll find hundreds of supplements promising to make menopause more manageable. But which ones actually help? And what are the risks? Let's take a balanced look at menopause supplements, their potential benefits, their downsides, and what the science really says. Part 1. Understanding the landscape. Narrator. First, it's important to remember that dietary supplements are not regulated like prescription drugs. The U.S. Food and Drug Administration doesn't test or approve supplements for safety or effectiveness before they reach the market. That means what's on the label may not always match what's inside the bottle. So before you buy anything labeled menopause support, it's critical to understand both the evidence and the limitations. Part 2. The most common supplements. Let's look at some of the most popular categories of menopause supplements and weigh their pros and cons. Black cohosh. Narrator. Black cohosh is an herb native to North America, often found in capsules or teas marketed for hot flashes and night sweats. Pros. Some small studies suggest black cohosh may help reduce hot flashes and other vasomotor symptoms. It's plant-based and has been used in traditional medicine for centuries. For most people, short-term use appears to be well tolerated. Cons. Research results are mixed. Some studies find benefits, while others find none. There have been rare but serious reports of liver damage, although the link isn't fully proven. Quality and dosage vary widely among brands. It can interact with medications, including hormone therapies or drugs affecting the liver. Bottom line, black cohosh may help some women modestly, but it's not a guaranteed fix, and medical supervision is important. Red clover and soy isoflavonones. Narrator. These are plant compounds called phytoestrogens, substances that act somewhat like estrogen in the body, though much weaker. Pros. Some women experience fewer or less intense hot flashes when using red clover or soy supplements. These ingredients may have heart and bone health benefits due to their mild estrogen-like effects. They're generally considered safe for short-term use in healthy women. Cons. Evidence for symptom relief is inconsistent. Many studies show minimal or no improvement compared to placebo. Because they mimic estrogen, they may not be appropriate for women with hormone-sensitive cancers, such as breast or uterine cancer. Some people experience digestive upset or headaches. Bottom line, soy and red clover might be worth exploring with your healthcare provider if you prefer plant-based options, but the benefits are usually mild. Evening primrose oil. Narrator. Evening primrose oil is rich in gamma-linolenic acid, a fatty acid thought to support hormonal balance. Pros. Some users report relief from breast tenderness, mood swings, or mild hot flashes. It may support skin and hair health, which can change during menopause. Cons. Clinical studies don't show consistent benefits for menopausal symptoms. It may cause nausea, diarrhea, or headaches. It can interact with blood-thinning medications or increase bleeding risk during surgery. Bottom line, evening primrose oil has minimal evidence for menopause symptom relief, though it's generally low risk when used responsibly. Dong Quai. Narrator. Dong Quai, sometimes called female ginseng, is a root used in traditional Chinese medicine. Pros. It's believed to support circulation and hormonal balance. Some users say it helps with mild hot flashes and fatigue. Cons. There's little scientific evidence that Dong Quai effectively reduces menopausal symptoms. It can increase sensitivity to sunlight and interact with blood thinners. Its estrogen-like effects may make it unsuitable for women with certain cancers. Bottom line, Dong Quai is popular in traditional medicine, but evidence for its effectiveness in menopause is weak. Maca root. Narrator. Maca root, from the Peruvian Andes, is an adaptogenic plant often promoted for energy, libido, and mood. Pros. Some small studies suggest maca may improve mood and sexual desire in menopausal women. It's nutrient-rich, containing amino acids, vitamins, and minerals. Generally considered safe for most people. Cons. It does not appear to reduce hot flashes or night sweats in clinical studies. Quality varies greatly between brands. High doses may cause digestive issues or sleep disturbances. Bottom line, maca may help with energy and mood, but it's not proven to relieve core menopausal symptoms. Ashwagandha. Narrator. Ashwagandha is an adaptogen herb that supports the body's stress response. Pros. Some research suggests it can help reduce anxiety, improve sleep, and stabilize mood, common menopause challenges. It's generally well tolerated at moderate doses. Cons. It doesn't directly reduce hot flashes or hormonal symptoms. It may cause drowsiness or interact with thyroid or sedative medications. Bottom line, ashwagandha may help manage menopause-related stress and sleep problems, but it's not a hormone substitute. Omega-3 fatty acids. Narrator. Omega-3s, found in fish oil or algae oil, support heart, brain, and joint health. Pros. May improve mood and reduce inflammation. Beneficial for cardiovascular health, which is important after menopause. Cons. There's no solid evidence they relieve hot flashes or night sweats. High doses can cause stomach upset or interact with blood-thinning medications. Bottom line, omega-3s are great for general health, but they're not a menopause-specific remedy. Part 3, the big picture. Narrator. So what's the takeaway? Most menopause supplements have modest benefits at best. Some women experience mild relief, others notice nothing. The biggest challenge is that supplement quality varies, and without strict regulation, 2 bottles of the same herb may contain very different strengths. It's also important to remember that menopause affects each person differently. Genetics, lifestyle, stress, and underlying health all play a role in how symptoms appear and respond to treatment. Part 4. Safety and smart use. Narrator. If you're considering a supplement, here are smart safety tips. Talk to your doctor first, especially if you take prescription medications, have liver or thyroid conditions, or a history of hormone-sensitive cancers. Check for standardized extracts. That ensures consistent potency from batch to batch. Buy from reputable brands. Look for third-party testing seals, such as USP, NSF, or Consumer Lab. Start low and go slow. Monitor your body's response and any side effects. Combine with lifestyle habits. Regular exercise, balanced nutrition, good sleep, and stress reduction all enhance well-being during menopause. Part 5. Final thoughts. Narrator. The promise of a natural menopause cure is appealing, but there's no magic pill. Supplements can play a role for some women, but they should never replace evidence-based medical care or healthy lifestyle choices. For hot flashes and severe symptoms, talk with your healthcare provider about all available options, from hormone therapy to non-hormonal medications to integrative approaches that combine lifestyle, nutrition, and mind-body support. Ultimately, managing menopause is about balance, finding what works best for your body, staying informed, and making choices rooted in science and self-care. Music fades out,